Welcome, everyone. I'm Kristina Johnson, President of The Ohio State University. Tonight's event is the second in a series of virtual town halls focused on COVID-19 that will take place each month through April. Thank you to everyone who's helped to organize and plan these events, and thank you to everyone who is participating. As always, we are committed to keeping you informed with the latest information about the university's COVID-19 response, which continues to evolve as we learn more and as the pandemic evolves. I'm pleased to report that we're solidly on the right track in our fight against COVID. Our 7-day average positivity rate for all students living on or off campus has been consistently less than 0.5%, which is truly remarkable. Because of our low positivity rate, we have greater than 90% of our quarantine and isolation beds available for students who need these spaces, according to our A+ rated Safe and Healthy Buckeyes dashboard. Since last fall, we have carried out over 400,000 tests for COVID-19 on campus. And this spring semester to date, we've performed more than 162,000 tests. To put that into context, Ohio State's COVID testing numbers at all campuses are greater than those of 10 states. Tests are given and processed on campus, allowing for quick results that let contact tracers connect with infected students and help them isolate. Your collective efforts in support of one another are paying off. I'm proud to be part of such a caring and conscientious Buckeye community. As we address this challenge together, we continue to succeed in advancing our overall mission and building a better world. As we look to the end of spring semester, we want to acknowledge questions about commencement. We understand the importance of commencement in the SHU to our graduates, their families, our faculty, students, and staff. We have a team evaluating an in-person event, recognizing this decision impacts our campus, city, and state communities. We are also committed to celebrating our 2020 graduates at an in-person event and are exploring options to recognize these students during the coming year. We'll continue to work in partnership with our city and state officials to make the best decision possible for everyone. With improving COVID-19 trends and continued vigilance about public health measures, I'm pleased to share that my leadership team and I have begun preparations for a fall semester in which campus life will be significantly reactivated. To that end, I've asked Provost Bruce McPheron, Senior Vice President Melissa Shivers, and Interim Senior Vice President Paul Patton to co-chair a task force on reactivating campus for fall 2021. If conditions continue to improve, there'll be more teaching, learning, and student activities taking place in person on our campuses. As we prepare for autumn, we're already enrolling students for summer courses. With fewer students on our campuses during the summer, we will have expanded opportunities for in-person teaching, learning, and activities even under our current health protocols. The well-being of our university community will always be our #1 priority, so any decisions we make for the coming year will be grounded in the expertise of our public health and medical leaders and the latest data and science. I know there are many more questions about what the future will look like. While we don't have all the answers right now, we'd like to share what we're thinking about and how we're planning for it. So please allow me to introduce our speakers for tonight's town hall. To start off, we have Dr. Andy Thomas from the Wexner Medical Center, who will provide a brief update on the spread of the virus, as well as the state's recent vaccination distribution plan. We'll then hear from Executive Vice President and Provost Bruce McPheron, Senior Vice President for Student Life Melissa Shivers, and Senior Advisor and Interim Senior Vice President for Talent, Culture, and Human Resources, Paul Patton. We're also delighted to welcome back our moderator for our second COVID Town Hall meeting, Dr. Teresa Long, former Columbus Public Health Commissioner and Special Advisor on Community Engagement to the College of Public Health. Finally, we are pleased that some experts from across the university are also present to answer questions. We thank Drs. Morley Stone, Amy Fairchild, and Peter Moeller for their presence tonight. Thank you again for being here. And now I turn the program over to Dr. Thomas.
Thank you, President Johnson. It's a pleasure to be here. I'd like to start out beginning with just a little background on where we are with hospitalizations and case numbers around the state. Many of you remember back in the fall, certainly through December, we were having significant concerns about increasing both case numbers as well as hospitalizations. It's great to bring good news to the table. We've gone from a peak of over 5,000 patients with active COVID in the hospital back in mid-December down to just over 1,100 patients in the hospital today. And in Zone 2, which is our region of the state, we went from over 1,200 patients with active COVID in the hospital in mid-December to under 300 today. Here at the Wexner Medical Center, we peaked at just over 200 patients in mid-December. And as of this morning, we're just over 30 patients actively being treated for COVID in the hospital. So these numbers are outstanding and show real progress in terms of both control of the disease as well as preventing the most at-risk members of our population, which would be the elderly and those with underlying health conditions, from getting severe disease and needing to be in the hospital. So with that background, I'm going to turn to the state's vaccination program. The slide you see up on the screen is from the state's vaccine database. We have nearly 1.7 million first doses of vaccine that have been delivered to the citizens of Ohio. This is a publicly facing website that's updated daily. You can drill down at the county level, drill down by age, gender, race, ethnicity. It's really an excellent website if you're interested in this. But as you can see, for the groups between 75 and 79 and the groups over age 80, we've now reached over 50% of the population in the state that's been vaccinated. It's been terrific progress. We continue to see increases in our vaccine supply week over week. This coming week, with the announcement of the J&J vaccine this past weekend, we'll have nearly 500,000 doses of vaccine, first dose vaccine coming into the state. We're just 3 or 4 weeks ago, we were in the low 100,000s at about 130,000 doses per week. So as we see that amount of vaccine continue to grow, it just means that the state is able to open up vaccination to more and more people. Next slide, please. It's also important to recognize that there are over 1,200 locations throughout the state, up from only 700 a few weeks ago, and over 100 locations in Franklin County where you can get the vaccine. So while we talk about the Schottenstein Center a lot, and that's our major presence here on campus, almost every retail pharmacy in Franklin County, as well as both the Columbus and Franklin County health departments, as well as the other hospitals in the city, all have vaccine locations around the county. So over 100 locations in Franklin County and over 1,200 in the state. Next slide. Briefly, I want to touch on 2 things off this slide. I'm not going to read through the entire slide. First, I'd like to talk briefly about 1A vaccination for healthcare workers. You may remember, if you were on the town hall last month, we'd gone through a relatively difficult period where we needed to cancel some vaccinations for healthcare workers. Not just our hospital, not just our university, but a number of hospitals around the state continue to work with the state and the Ohio Hospital Association. And we're very pleased to announce that this week we've been given permission to restart 1A vaccinations. We are able to vaccinate up to 5% of our total first dose allocation of vaccines. So this week, that's 350 individuals that are 1A healthcare workers that will be invited for vaccination, and we'll be continue doing that weekly moving forward. Information came out to medical center faculty, staff, students, as well as health science college faculty, staff, and students earlier today that describes the outline of this program. And last bullet on this slide I'd like to touch on is Group 1C that was just announced just this afternoon by the governor. That is an extension starting this Thursday for individuals ages 60 to 64. In addition, they've added some medical categories, including women who are pregnant, including individuals who have type 1 juvenile diabetes, people who've had a bone marrow transplant, and ALS or Lou Gehrig's disease patients. In addition, the state has opened some new essential worker categories, including law enforcement and corrections officers, early childhood education staff, and job and family services employees, as well as funeral home employees. So there's more information to come from the state on the definitions of these, but we're excited to know that there are additional members of our community that are going to be able to be vaccinated in the coming days. Next slide. This is just to give you a sense of where we are with vaccinations. Once again, not to go through every data element on the slide, but the 3 circles, I think, tell us a lot. So our total first doses completed are nearing 40. In fact, today we would have crossed 40,000 individuals. This is data through Sunday. In terms of total vaccination since the beginning of the program, nearly 67,000 or just over 66,000 doses of vaccine delivered. Just an amazing number when you think of it. And as we switched to 1B in mid-January, as you can see, we vaccinated nearly 23,000 members of the public with first doses. And that's nearly 700 first doses for the public, each vaccine clinic since we've been at the Schottenstein Center. It's been a terrific partnership with the athletic department. I cannot thank the team there enough, Colin and Scott, and obviously Zen Riggs and Gene Smith, just outstanding partnership moving forward. Next slide. And last, I just want to briefly remind you, if you're interested in scheduling a vaccine, there are 4 ways to do that. Through your MyChart account, we are pushing out automated robocalls to individuals, notifying them when they are eligible, and you can hit one of the selections and be connected with one of our operators. Certainly, you can call your Wexner Medical Center provider's office and they can schedule you. And lastly, we have the vaccine hotline at 614-688-VAX. That we are retooling all of our computer systems based on the new announcement today by the governor. And by the end of business Wednesday, we'll be ready to schedule those individuals in 1C for vaccination moving forward starting Thursday. So with that, I'll turn things over to Provost Bruce McPheron for the next presentation.
Thanks so much, Dr. Thomas. Really appreciate that overview. Very, very hopeful numbers, and so glad to see the continuing evolvement at the state level with the guidance we're provided. With Dr. Shivers, I'm going to partner here for a second just to talk a little bit about summer term. We fully expect to see more in-person activity as we head into the summer semester here at Ohio State. Important to remember that for now, our components of safe and healthy requirements will remain in place. So we'll continue to follow that solid evidence-based public health advice. Students have in fact already started to enroll for summer term, as the president referenced. There will continue to be a blend of modalities. So we'll have online and blended experiences this summer, but we will continue to see an increase in our focus on in-person classes. As the president mentioned, that's made possible by our ability to manage the density fairly effectively this summer with regards to our classroom setting. Just a question that's often asked, and I'll deal with it right at this point, but health guidance at this point in time does not support a mid-semester reactivation of more in-person courses. We're all longing for that, but we do follow the evidence where it takes us. And at this point in time, continuing to stay the course with the work that we've been doing that has carried us to this point is really absolutely essential. With that, Dr. Shivers, I'll hand it to you for a little more information.
Thanks, Provost McPheron. I appreciate that. I want to just share a little bit before we get to the summer. I think it's important to share our processes for students moving out of their residence halls. So as we have over the past several semesters, move out will take place in a physically distanced format. Students will be asked to schedule their move out time and will need to limit the number of people who come to help them. We understand that moving out for the year may take a little more help than just heading home for winter break, but we also need to ensure that we are continuing to operate with physical distancing and also, of course, with mask wearing, just to help keep everyone safe. Our residential students will receive information about scheduling and move out processes in early April. Now, to transition over to the summer, in terms of summer housing, as we typically do, there will be some limited on-campus housing available for enrolled students. We will also make some of those housing accommodations available for students who can't go home over the summer due to issues related to the pandemic. We are still working through the details on what residence halls will be used for summer housing. In addition, I want to share some information about our campus facilities and services as we continue to receive questions about how they will also operate during the summer. We do intend to maintain access to our recreational facilities and also the Ohio Union and dining with the safe and healthy requirements and protocols. They'll still be in place. As is typical for any summer, our hours of operation will change for streamlined schedules to account for reduced summer density. We've also received questions about testing for the summer. And what I'll say is that testing will remain a part of our risk mitigation and surveillance protocols into the summer term. We are continuing to evaluate exactly what that will look like, and we'll certainly keep all of you abreast of those protocols. Provost McPheron, back to you.
Thanks, Dr. Shivers. Let's pivot now perhaps to thinking a little bit about autumn of 21, our fall semester, both the types of instruction that we are anticipating at this point, but also what life will be like on campus. I'd like everyone to keep in mind that this is balancing that we're doing here. Early decisions clearly make it easier for people to plan, but waiting a bit gives us better modeling and a better sense of the information that we need about what fall might actually look like. If you stop here on a first day of March, the first day of our 8th semester in the spring semester, and think about the society around you and how much has changed just since the holidays, I think you'll have a good understanding of how much we have to really balance our thinking for the autumn. We're planning for fall with hope to be back as fully in person as possible, but we're building contingency plans at the same time so that we can approach the academic year with the right health protections. On the academic side, we have a transition task force led by Senior Vice Provost Kay Wolf and Dean Trevor Brown of the John Glenn College of Public Affairs, working on specific recommendations for course delivery and other topics related to teaching and learning. To have the flexibility that we need to collect more information, we've adjusted some timelines. As we work through these decisions, I'd like to have you understand both the eagerness that many have to be in person, but also the anxiety that others have about returning to our campuses. As more students return to campus, that means more faculty will be here to teach them and more staff to support everyone. We're thinking about each of those groups and their experiences under a variety of circumstances. Dr. Shivers, what about the student life perspective?
Thanks, Provost McPheron. As you all know, and has been very well communicated this evening and always, central to our mission is creating a safe and healthy home on our campuses for students to learn and to live. And as we go about the work of planning for autumn 2021, it is important to also remember that as our state's flagship and land-grant university, the in-person experience really is fundamental and core to who we are as an institution. Over the past year, we've done amazing things with technology, and we will certainly leverage many of these as we return to in-person opportunities. Likewise, technology and innovation is critical to extending the reach, serving the needs, and advancing the educational mission of The Ohio State. Having said that, it must also be remembered that Ohio State's rich legacy was born in a single building that served multiple purposes: classroom, laboratory, and living space. Over the years, these complementary uses have emerged as hallmarks of the Ohio State experience, and certainly a hallmark of the Buckeye experience. The in-person student experience is the iconic Ohio State experience, and we must keep this foremost in our minds as a guidepost into the future. We have always known how important the residential experience is, and what we also know is that the residential experience is what most of our students want to. Next slide, please. I was fortunate recently to connect with some Buckeyes who, like I do, hail from Georgia. One student wrote to me after the meeting and shared the following thoughts. She said, "I'd argue that it's more fun to be on campus with some extra rules rather than being stuck at home without friends and professors to interact with. Students are indeed engaging with us virtually in ways we never thought that they would." Next slide, please. January's virtual Spring Student Involvement Fair resulted in the highest attendance that the spring version has ever attained. Buckeye-thon, they held their annual dance marathon virtually and was able to include more engagement offerings than ever before, raising more than $2 million in 1 year. Our sorority and fraternity members are also holding virtual programs that allow them to create avatars and engage with one another on screen as they would in real life. These tools, features, and opportunities have been priceless throughout the pandemic, and yet students still want to be here together on campus with their friends, going to classes, learning in our laboratories, developing through on-campus jobs, connecting and deepening their sense of community. They also want to make sure that they're safe while doing it. Next slide, please. Where else can you go and have an oval where students and others meet and connect with one another? Where else can you go where current, past, and future Buckeyes cannot wait to get back into the shoe, or maybe even in their classrooms? Where else can you go and find a mirror lake where many former Buckeyes recall memories of their wedding day? And where else can you go where they have an Ohio Union and a Hale Black Cultural Center that has served as their home for students during what has been the best and the worst of times? Nowhere else but Ohio State. All of these and more reasons why it's important that we find our path safely back to the iconic Ohio State experience. Paul?
Thank you, Dr. Shivers. Let me first say I love the quote you shared from Olivia. I think that represents what many of us feel. Thank you, and we've learned a great deal over the past year about HR and its intersection with the COVID-19. And I really think it's a great opportunity for us to capitalize on what we've learned to advance the academic agenda. You know, it basically comes down to a couple questions. What are the needs of the university? And how can we best support those needs effectively, efficiently, while keeping an eye on the mission, as well as employee engagement and the satisfaction of our workforce? As Bruce mentioned, a task force on transition, HR also has a task force on transition led by Kim Shoemate, and we are examining those very questions. And we hope to come up with a, for lack of a better term, a toolkit for our leaders and our managers to use to fundamentally get our employees back to work safely, securely, and also with an eye towards making sure that we can pivot at a moment's notice based on the science and based on the data. A couple highlights of what we are preliminarily thinking is that the return of employees will be gradual and phased in as we look to increase the density of our population slowly, while continuing to adhere to the protocols necessary to keep our community safe. When we begin to transition, managers will be encouraged to work with employees who need time to make new arrangements for childcare or other needs they have been managing while working remotely over the past year. There is also likely to be an increased interest in the university extending flexible work policies that may now be an option for those who can effectively work remotely and differently prior to the pandemic. And as more specific timing and details are available regarding an aligned approach to return to campus, we will be sure to share more information in the future. But it's also time to revisit some tools that have been available in the past and consider how those tools might be applicable to the Ohio State University. Not just telecommuting, but changing the core hours of work and using alternative schedules. So just a snapshot of some of the things that we are looking to do. And the task force is going to work tirelessly to make sure that we have comprehensive options, as well as we have the ability to talk to our customers and our constituents as we make these recommendations. Dr. Long, turn it over to you.
Good evening, and thank you, Mr. Patton. I appreciate that. And thank you to each of you for joining us this evening. A special thanks to each of our speakers for sharing the information, all of this information. And obviously there's new hot off the press information coming your way tonight. So again, thank you for being here tonight, and to our speakers for being here to answer more questions. And there are a lot of questions. And since I know that's of great interest to get to the Q&A portion, let's go right there. And I want to share that we appreciate everyone who did submit questions ahead of time. And you did. There were lots and lots and lots of them. So we're going to try and answer as many of those as we can. I'm going to start out with a few that cover a range of topics that were of interest to many people, to, well, multiple questions in the same area. I would also encourage you, and I can see it happening already, that you are using the Q&A function. So please, while we have had a lot of information come across from our different speakers, please put your question in the Q&A. Dr. Thomas and Dr. Moeller are actually going to be working live to try and respond to at least some of the vaccine questions, because we know those are very real. But again, please put those in the chat, and of course we will answer them, and I will share more about how all of these questions and their answers will be shared back with you. So let's get started. So Dr. Thomas, you're up first. You came with some interesting and really good information today, good news, but nonetheless, still lots and lots of questions about vaccine and vaccination. So what is the timeline for Ohio State students, for faculty and staff to be vaccinated?
Thanks for the question, Teresa. You know, it's probably too soon to tell for that broad of a swath of individuals. I think the good news is the state's getting more and more vaccine each week, at nearly 500,000 doses this week. I will tell you, just in the 60 to 64 group that becomes eligible on, is part of who becomes eligible on Thursday, there are over 700,000 people. So the state is pretty committed to going down age brackets. 60 to 64 is this Thursday, potentially in a 2 to 3 weeks. It has not yet been determined yet when they would go to 55 to 59 and then 50 to 54. There may be other essential worker categories as well. So as the amount of vaccine in the state increases, the state will continue to move forward with additional categories. But I do feel like we're close, probably in the next 2 to 3 months, of moving from this high demand, low supply state to a point where, say by June, to be honest, when we are getting to vaccinate the average 20, 30, or 40 something who doesn't have a high risk medical condition, I think we're going to be in a really high supply, low demand state, which is kind of hard to visualize today. But we're already talking about how do we make sure we make it easy for people to get vaccinated, get vaccines close to where they are. How are we going to market this to say, why is it helpful for someone who's 30 and otherwise healthy to be vaccinated? We think it's important to get to that herd immunity that was mentioned earlier. So that we can really, as Dr. Vanderhoff from ODH likes to say, put COVID in the corner. It only bumps into people that have been vaccinated, and that's how we keep it from spreading through society again come next fall.
So Dr. Thomas, that's really good information. And yet I'm going to stick with you on this one, because this is by far the biggest questions, and just kind of watching what's coming up in the Q&A. So what about Ohio State, and will Ohio State provide the vaccine for students, faculty, and staff? And
no, that's a great question. Currently, we're scheduled to be at the Schottenstein Center through the end of April. That's just the way we laid out. The first plan was for 3 months. In about a month, we're going to be assessing where we should be doing vaccinations. Will we stay at the Schottenstein Center? Could we do vaccinations somewhere else on campus? But I think my gut is that by the summer, certainly by the beginning of fall semester, that the vaccine is going to be pretty widely available, at least in Ohio. Obviously, we have out-of-state students and other things, but I think the vaccine will be pretty widely available for any adult who wishes to be vaccinated before fall semester. I think it's important to realize as far as the meetings I've been in, there's no plan to have a requirement for people to be vaccinated. But for those who want to be vaccinated, my gut would be by the beginning of fall term, any adult in the state of Ohio, including an Ohio State student, faculty, or staff member, should have the ability to get vaccinated if they so choose to.
So again, really good news, and it's hard to predict the future. But again, I think there's a lot of question about, will Ohio State provide the vaccine for its students and faculty? So I think you've answered that as best
we can today. I think we've had a great partnership with the Wexner Medical Center and campus since the beginning of this, and I think we'll continue to do that. And we'll have more information certainly by the end of spring term on what the summer and fall is going to look like.
Right. So let me ask you, and this is again free-flowing conversation here. There are questions coming up, and actually you made mention of it yourself. So it's coming back to you, Andy, and maybe Dr. Moeller would like to weigh in as well. But could you briefly, or perhaps give us an overview of the different vaccines. You did speak last time about the two mRNA, the Moderna and the Pfizer vaccines, but you've mentioned the J&J, which is clearly a different kind of product and has different characteristics. So could you say a little bit more about that?
Actually, Peter, I'll let you take
Perfect.
that if you'd like.
I'll start and then Dean Fairchild can join in
Great.
as well. I think if you had asked any of us a year ago, kind of where we would love to be a year from last March, to be able to have 3 different vaccines against COVID-19, we would all be jumping up and down and super excited. They do act a little bit differently and they behave using different technologies. As you mentioned, the Moderna and Pfizer act through mRNA technology. The new one, J&J, acts through what we call viral vectors. So basically, they've taken a small piece of the spike protein, put it in a very innocuous viral vector.
Sounds like Peter froze. I can take it. Amy, do you want to take it? Take that one? Pick up where Peter left off?
Well, I'll let you take the one on the different kinds of vaccination. But the thing I would just add here while Peter's unfreezing is I'm really pleased with all the interest on the focus on vaccination. High rates of uptake are going to be super important no matter what vaccine you have accessible to you. As far as I'm concerned, I don't care which it is. I just would want to stress that equity is also important. And so I tend to think of this not in terms of when am I going to get vaccinated, but rather are the people who need it and who are most at risk getting it. And I wish I could say the answer was yes right now. Not everyone who needs it is getting it at the same rates. We're still seeing some stubborn racial disparities. Even with the rollout by age, we see disparities. So as a community, I would just remind us to keep advocating for those who are at higher risk because of routine, lengthy, unavoidable exposure to a lot of people.
Yeah, Amy, I'm really glad you brought up that topic. I did want to make the point that we did open our vaccine site at OSU East Hospital last Friday, and we have additional vaccine clinics planned there this week and each week moving forward. So we had our first session on Friday that was public facing. We had a vaccinated staff there back in December and early January, but this is our first public facing session. We had approximately 200 individuals for that 4-hour session to work out all the logistics in the room and the staff and everything. But we'll be doing more this week, more next week. And we're continuing that. It is limited to about 10 zip codes that are in Central Columbus, South Columbus, the Near East Side, and then up the Cleveland Avenue corridor to get exactly to the point you're talking about, Amy, which is to try and make sure that we're reaching those that are either underserved by the health system or by the healthcare system in general, or that are more at risk. And we all know that certain essential worker categories and other groups that are disproportionately from minorities are at higher risk for both getting the virus as well as bad outcomes related to social determinants of health and their underlying health status when they get infected. So we're actually quite proud of the last data I saw, the first 240 individuals signed up, approximately 55% were non-white. About 45% of those qualified as Black and African-American, then 10% in other minority groups. And that compares to at the Schottenstein Center closer to 10% of a non-white patient population. So we think we're reaching the right target neighborhoods. We actually developed those in conjunction with Dr. Mashika Roberts at Columbus Public Health. Columbus Public Health is doing their own, what they're called opportunity zip codes, opportunity neighborhoods around the city. And then the other health systems in town are also doing similar outreach in those communities and providing vaccination. So it's a group effort across the entire healthcare system of the city to try and reach those folks that are have difficult time accessing the vaccine.
Well, Dr. Fairchild and Dr. Thomas, thank you so much. That's really important and it's been, I think, on many of our minds. So I appreciate you speaking about that right up front. So thanks, Amy and Andy. So
Is Peter not back?
Yeah, I don't see
Okay.
Peter.
So that I can pick up where he was.
Thanks.
So the J&J vaccine is where they take a piece of the spike protein to essentially sensitize your immune system and put it on a relatively innocuous adenovirus. Then it creates the same sort of immunologic effect. Just the pros and cons of the different vaccines. And, the Pfizer and Moderna are obviously 2 doses. Pfizer is at a 3-week interval and Moderna is at a 4-week interval. The J&J is a single dose. Some of the efficacy rates that you hear talked about, Moderna and Pfizer are quoting around a 95% efficacy. That means efficacy for preventing you from getting the infection. And the J&J for the US studies was in the low 70%. All worldwide, they were in the mid 60s in terms of preventing you from getting the illness. But what's really important and sometimes is lost in that data is that J&J is incredibly effective at preventing severe disease, preventing hospitalization, and preventing death. And that's really what we're trying to do here with our vaccination program with those at highest risk, is to prevent people from dying or getting severely ill from the disease. And J&J clearly meets that standard. It's a little hard to do an apples to apples comparison between the vaccines because they were tested in different parts of the world at different times of the pandemic. But we all are big believers that when you have the chance to get vaccine, you should get whatever one they're offering that day, because they're just, J&J, you don't need to come back a second time. And also there are a slightly higher rate of significant side effects, body aches, low-grade fever, et cetera, for 24 hours with the second dose of Pfizer or Moderna. And with J&J, that's less of a concern. So there's pros and cons on either side.
Thanks, Dr. Thomas. Thanks, Andy. That's really helpful because I know that was part of the whole Q&A and maybe we helped answer some of those questions. I see Dr. Moeller is back. Anything else, Peter, you'd add? But otherwise, I'm ready to move on to other questions.
Let's move on. Thanks.
Okay, great. I'll be back to you, I'm sure. So somebody mentioned, or maybe they didn't, variants. Yes, one of our speakers mentioned variants. So this one I'm going to pitch to you, Dr. Fairchild, and then maybe come back again to you, Dr. Moeller, as well for some additional thoughts. So talk to us about variants, Dr. Fairchild. What the university is doing to track them, and how might they impact the plans for reactivating the university?
Thank you. And there are really two wings of the university looking at this, and Peter will talk about what Wexner Medical Center is doing. I'll talk about a little bit about what the Applied Microbiology Service Lab is doing. This is the lab that's now doing all of our saliva testing with such rapid turnaround time, which is great. As of this week, they're starting to sequence all of the positive results that are coming in through that lab. And we know from talking to our colleagues at other universities around the country that we can certainly expect to see some variants of concern, but that's not necessarily a cause for alarm. And these include the UK variant, the Brazil variant, the South African variant, and potentially a California variant, though it's not clear exactly how alarming that one is or isn't. But so these would be variants that are potentially more transmissible, that potentially cause more serious disease or potentially reduce the efficacy of vaccination. So the important thing is that we have got our eyes on every positive test that's coming through our microbiology service lab. And we're going to have a lot of ways to respond. The comprehensive monitoring team looks at all of our data every day. But the one thing that certainly everybody can do right now is to make sure you adhere to the testing protocol on campus. If you feel sick, stay home. And if you are infected, cooperate with the contact tracing team, share all of your contacts, and really adhere to isolation and quarantine procedures. And as the semester progresses, as I say, there may be a lot of ways that we have to respond. The comprehensive monitoring team may recommend changing the testing cadence if we find a variant of concern in say a particular congregate housing setting. But all of the modeling, as we look forward to the fall, I think it's important to underscore that all of the modeling that our data analysts are doing right now through the comprehensive monitoring team is accounting for the possibility of more transmissible variants. And even though they're doing that, I'm still remaining very hopeful about the fall.
That sounds really good. Dr. Moeller.
Yeah, I think just to add to that,
that's really positive. Thanks, Dr. Fairchild.
I think just how incredibly proud of that I think we all are about how Ohio State and all colleges across Ohio State have really been leading in the science related to COVID-19. And I think what we have all seen is that the more we know, the better we can be prepared to deal with the downstream. Viral variants are normal. All viruses go through this evolution process to try to make themselves better able to deal with the environment. We've seen this since day one of this. It started to pick up, and we continue to look at this. There's two things that we're really looking at in the labs, really across all of Ohio State. One is, do our diagnostics still work? And so far, so good on that. We continue to evolve our diagnostic testing to make sure that when we tell someone they're positive, and they're negative, they're negative. I think the second thing is that Ohio State has taken a very active lead in making sure that we understand the impact of these viruses and these viral variants on things like therapeutics. So do things like antivirals continue to work? Does this have an impact on our vaccines? And so this is a great group to check back in with. There's a lot of things out there on the news that may not be completely vetted or peer reviewed. This Ohio State group that you continue to hear from each month is a great group to check in to say, what's the best news out there? What's the best peer reviewed data out there? And so far, we have not seen data that's conclusive to say that the variants will impact the vaccine. So far, so good, but want to keep our eye on that.
Well, thanks, Dr. Moeller. That's actually really good news and helpful to hear about what's going on across the entire enterprise in the research enterprise. And again, Dr. Fairchild, thanks. The work of the CMT that you're providing leadership for is remarkable. So let me stick with vaccine, at least for one other question, because it's one that's come up and I see it coming up right now, and that is about mandating or requiring vaccines. So President Johnson, I'm coming to you. Will the vaccine be required for students, faculty, and staff?
Well, thank you very much, Dr. Long. No, it will not be required, but we strongly encourage everyone to get vaccinated. And, I'm excited when my number's up to get vaccinated. So I'm looking forward to encouraging everybody else to as well.
Thanks. And I think that's really important to understand. So I appreciate that. And let me stop for a moment. I just want to be sure that all of the questions that are coming in, we're probably not going to get to all of them. So please know that we will share this information. We will share the questions and answers on the Ohio State Safe and Healthy Buckeye website. We will send a link to you through your on-campus newsletters as soon as those are available. This is also being recorded, so of course that too will be available. Please feel free, you are already, but continue to post questions in that Q&A because we're picking up some of the real-time ones and moving them forward. So again, thank you for your participation. But with that, I'm going to leave and turn a little bit to some different topics besides just vaccine. And again, thanks to Dr. Moeller and Dr. Thomas, because they're trying to answer some of those vaccine and other questions real time in the chat as well. So here's to Dr. McPheron, and maybe Dr. Fairchild and Dr. Shivers would have some additional thoughts. So how will the fall look different from this past year, do you think? And will testing and masks and distancing still be required?
Well, here's the first thing. We may not be able to see it, but you will be vaccinated. Please, when your number comes, take the opportunity. As you've heard previously, whatever they're offering that day is the right choice for you. It's the right choice to take advantage of the vaccine. One thing that we anticipate will be different, and I see it as I look out my windows at the Oval here from Bricker Hall, is the fact that there will be more people on campus if our aspirations deliver. We are planning, as we've said several times already this evening, for a reactivated set of campuses, not only Columbus, but our regional campuses as well. And we hope that our delivery of courses will actually be able to match that our student experiences outside the classroom will match that all of the other support for faculty, staff, students, and our community will begin to re-engage. That said, we are adhering to the best public health advice. And so as we think toward the future, we're thinking about the physical distancing, masking that has really carried us through to this point in time. It's really, really important that we stay committed to the best public health advice that we possibly can find. And as you've heard, much of that is actually deriving from experts right here at Ohio State. We anticipate maintenance of the testing regimes. We'll be monitoring what is happening with the virus, not only in our Ohio State community, but more broadly, so that we can modify at the appropriate time any of those elements that we've put into place. But as we think about how to keep this community safe and how to achieve that reactivation in a way that benefits all of us, we will continue to stick with the advice that has brought us to this point. One really important element of this, of course, will be the density in classrooms. And we're still months out from autumn semester. As I pointed out earlier, with summer, we have fewer classes and fewer students, so we have a lot more ability to ebb and flow, if you will, in terms of the density within our classroom spaces. As we bring back the thousands of classes that are offered in a fall semester, we have to be a little bit more prepared. We're trying to be agile, but this is a big ship that we're turning in a small harbor. And so we really need to think very carefully as we plan ahead for how courses will be offered that give us the most flexibility. Perhaps Dr. Fairchild and Dr. Shivers has some things to add to this, crystal ball for the future here.
Well, I guess sometimes I feel like I'm the crystal ball, or at least I'm working with the people who have the crystal ball. So one of the things the comprehensive monitoring team is doing is trying to give exactly what Provost McPheron said, the best evidence-based public health advice. And we're just now getting some of the evidence that we need to answer these very important questions, particularly when it comes to what needs to be the cadence of testing, and also what kind of density can we sustain in the fall. And we're accounting for different variants of concern scenarios. We're accounting for some high vaccination scenarios and some low vaccination scenarios. And so I can't give you the specifics because, as I say, we're still working through those, but I'm quite hopeful that maybe I'll be able to drop my Dean of Quarantine nom de plume sometime in the next couple of months. And I say this as somebody who always takes a precautionary stance. When it comes to the pandemic, being in public health, it's in some ways my job to make sure that we're thinking about the worst case scenarios. But as I say, right now, I'm feeling very hopeful that we can do things like reduce the cadence of testing for individuals who are vaccinated, and begin to do a different kind of testing, wastewater testing. As some of you are aware, we're doing wastewater collection at 6 different catchment sites around campus. So we have a lot of eyes and ears around, and I'm hopeful that we can reduce distancing too. So I think it's unlikely that fall of 21 is going to look like it may not look exactly like fall of 19, but all signs are pointing to right now it's not going to look like fall of 2020 either.
And I would just add too that, Amy, much like you're ready to get rid of the title of Dean of Quarantine. I'm also ready to just say no to this idea of being the VP of No Fun, because that's also my new title. And you all could not see me earlier with all my excitement about bringing in student activities and getting people back together because Zoom was being quirky. So now I want you to see my excitement about the idea of being able to have our students to have events and gatherings all together again. As Olivia mentioned, as I shared in my presentation, I'm happy to be here, even if there are more rules, yet I'm also really aware of the significance of people being able to interact and engage in person with one another from a mental well-being perspective. So what I hope to see in the fall is bringing back more of those events and activities in a safe way. And we're already doing some of that right now by allowing some of our Buckeyes to have events of 10 or fewer. We'll continue with that phased approach to thinking about how we get other activities there. But see, again, it's not letting me be great. So anyway, I'm here, I promise. And we are still just excited about the ability for students to be able to reconnect and re-engage.
Well, Dr. Shivers and Dr. Fairchild and Provost McPheron, thank you for sharing those thoughts. And honestly, it's heartening. I feel for you and everyone, both an eagerness to move forward and yet some of the, and I think Dr. McPheron, you said the anxiety, the cautiousness that many are feeling as well. So we are on our way. There's no doubt that we're moving forward, but trying to be very thoughtful as we do that. So thank you for sharing that. So let me stick with you, Dr. McPheron. So we continue to get questions about what could it be like? So when will faculty and students know if classes are going to be online or in person?
Well, first, Dr. Long, let me assure our audience that Dr. Shivers is not the VP of No Fun. She really is committed to a successful student experience and knows that our staff and faculty are a major part of that. We even in these days, we try to have some opportunity to have a little bit of fun every single day. You know, the question of when is one of those abiding questions. For students who are interested in summer academic experiences, you and your faculty already know what the modality of offering those courses might be. And so your scheduling is underway, and you can see that listed online. And likewise, we're used to a timeline really in March where students who are scheduling for the autumn semester begin to see those same opportunities to peruse what classes are available and how they're going to be offered. As I said a little earlier, that's going to be a bit delayed. We're trying to use the data that Dr. Fairchild talked about to actually help advise us, knowing that, you know, I used the word crystal ball a little earlier. I actually have a magic 8-ball and it keeps saying ask again later. Well, there comes a point where we actually have to stop asking and make some decisions. And so our hope is that as we get through the next several weeks, we'll actually have the guidance that we need that allow us to land on the schedule that we can then publish for our students and faculty to understand what that autumn semester is going to look like.
Great. Well, that's good. And that's the crystal ball coming from you, Dr. McPheron, and obviously the VP of No Fun and the Dean of Quarantine. We've got a lot of nicknames going on here, but thank you for that. And thank you for sharing that. So I'm going to turn actually to employees because there are many questions coming from employees. So I think Mr. Patton, you might be up for these, but others could chime in as well. So will employees who are currently working from home be able to continue working from home, or will they have potentially more flexibility in their schedules? Could you respond to that?
I'm happy to. Really appreciate the question. You know, I think flexibility is the name of the game going forward. Again, we're evaluating the things that allow for a successful year. The number of things we did with respect to social distancing, masking, limiting the density have been proven to be very successful. So we're not in any particular rush to make sure that we get off track from that. In terms of flexibility, I think in my earlier comments, you know, we want to make sure we give our management team and the leadership team and our departments the ability to be flexible and helping them to manage through this with their particular workforce. So I'm very much in favor of using as many tools as possible to solve the issue around human resources, human capital, and that's certainly one that will get proper consideration.
That's very helpful. And I guess let me just dig in a tad more. What do you think the process will be like for returning staff to work on campus?
Well, again, it has to, returning staff to campus really has to match with the needs of the department and our overall academic mission. So when it makes sense for people to be on campus, they will be on campus. And when we have the opportunity or the ability to continue with the kind of distance approach and work from home strategies, if that's appropriate, then it'll absolutely be part of the consideration.
Okay, great. Thank you. So So the questions, again, keep submitting them in the Q&A, please. And I'm going to turn to Dr. Shivers. Hopefully we can catch her. I see a picture up there right now, because we continue to get questions. And so I'm going to just use one example, but you can go further about campus life. So when will events, could you speak to when will events be allowed on campus?
Sure. That's a really great question. So we have already started in a phased in approach to events and gatherings. So now we're at 10 or fewer students can gather together, and we continue and we'll use a phased approach in looking at the prevalence of the virus, as well as understanding how our students are complying to the safe and healthy guidelines. In terms of events that are not student organization hosted events, there is a university committee that is looking at when would be the appropriate time to bring those types of events and activities back. But right now, we're just continuing to use our phased approach to the process.
Well, that makes total sense. So thanks, but it's good to hear that, because I know that there are questions both that came in early that I hear, and obviously they're coming in right now as well. So thank you for that.
Of course, thank you.
So let me turn to a different question. And this is one that's being raised right now. So Dr. Fairchild, probably I'm going to pitch it to you, but others may want to chime in. This really is about students and students who will be vaccinated. Will they need to keep, and I think it's broader than probably just students, but the question has to do with students. So will students who are vaccinated still need to keep following physical distancing and other safe and healthy protocols?
Well, certainly we're going to need to, they'll have to follow any distancing protocols that we have on campus, because at a glance, we're not going to know who's vaccinated and who's not vaccinated. But it's very likely that a lot of things will relax in the fall. So I'm thinking about testing specifically. It's very likely that we will be able to relax the testing cadence for students who are vaccinated, but we're going to have to make recommendations about the cadence of testing for both vaccinated and unvaccinated students based on the best evidence we have at the moment in time, the remaining uncertainties we have about whether it prevents transmission to other people. We're going to have to follow CDC guidelines. We're going to have to follow Columbus Public Health guidelines. They are our partners in this, and we need to be doing what they are also telling us is best practice. And we also have to think about consideration of our particular setting. We're a congregate setting. We have lots of socialization. That's part of the experience, as Dr. Shivers said. So, and some of this is certain to change over time as we learn more, as we move successfully through the fall semester.
Thanks. I think there's a lot of us that are wondering about what will life be like just in general post-vaccination. And I think you're pointing out the importance of continuing to be cautious and using masks. And obviously some things and changing testing cadence makes sense. Probably there will be some changes around quarantine for people who are vaccinated as well.
Teresa, if I may, it's Bruce.
Sure.
And this may be a question from me to our medical professionals on this topic, because what I heard Andy and Peter saying earlier was that the magic of the vaccine is it's actually preventing serious illness, hospitalization, and death. And those were the markers. But there still are a lot of things we don't know that we may assume about what the vaccine does. We may know by fall some of the answers to some of these questions, but Andy, I think I'm right. We don't yet know, pursuant to that question about whether you need to follow the safe and healthy protocols. I don't know that we know that you don't get the virus and might be able to actually pass it on to someone who wasn't unvaccinated, or who was unvaccinated.
Yeah, that's a great question, Bruce. I think that is still being studied, I believe, by some of the vaccine sites around the country. We had two trials that went on here at Ohio State. They continue to look at that issue. I think the good news is that obviously the majority of the time they're preventing people from getting it at all. But even the Moderna and Pfizer that are at 95% are not at 100% in terms of preventing you from getting it at all. So I think what really in my mind, once we know that all high-risk individuals have been vaccinated and they are who want to be vaccinated and that they're protected, you know, if an individual gets it, they're at least as protected as they can be when they're around others that are at high risk. I think eventually a year or two from now, this starts to look a little more like flu season. Every year we talk about get your flu shot, get your flu shot, get your flu shot. In a good year, we have about 50% compliance with those over age 65 getting their flu shot. Unfortunately, people still choose not to do that and not to protect themselves. But I'm hopeful that this may, at least for the next 5 to 10 years, change people's mindset around that. Some of the questions Teresa was asking earlier, I personally think you're going to see Americans wearing a mask getting on airplanes for a long time. This is similar to what you see in Southeast Asia or in other Asian countries that had SARS and other infections 15 to 20 years ago, where you still see widespread use of masks in the wintertime to protect themselves, even though vaccinations are available for a lot of those illnesses. So I think people will probably act differently for a period of time, but then, you know, by 10 years, 15 years from now, who knows, it may drift back. But I think we don't know enough yet, but we're continuing to learn more every day.
Well, that was both a really great question, Dr. McPheron and Dr. Thomas. I completely concur with you. I think we're going to be, and I used to be known as Debbie Downer, so maybe but I do think we're going to see mask wearing for some time, and I think that's just something we probably all need to get used to. And
one thing to add, Teresa, maybe to that around flu. We have yet this year at the Ohio State University Wexner Medical Center had one positive flu. We've had no positive flu tests the entire fall and winter. In fact, Dr. Vanderhoff from the ODH quoted a stat on a meeting I was in the other day that I believe there have been under 200 total flu influenza admissions to hospitals in Ohio this season. By this time, normally it would be in the multiple thousands of flu admissions to the hospital. So it's really just shows you that masks work. We saw the same thing in the Southern Hemisphere over last summer when masking was prime there due to COVID, but it really prevented flu as well.
Masking, hand washing, distancing, they're all good, but it's an amazing story around influenza, just amazing. So let me stick with another question that's coming up in the Q&A quite a bit, and it has to do with populations that may have and likely do have greater risks and how likely they are to get moved forward in a prioritization. So people with cancer, people with solid organ transplants. So again, can you make a prediction around those with cancer survivors?
Solid organ transplants are already on the list. Those are actually
on
the list as of a couple weeks ago.
Okay, good.
Bone marrow transplants were added effective this coming Thursday.
Right.
One thing, just to step back for a second, when there's been a myriad of studies that have come out looking for correlations between different underlying health conditions in either severe disease or death from COVID that show, you know, compared to the average health population, that it's higher. If you look at all those studies and think about emphysema, asthma, cancer, heart disease, diabetes, you know, obesity, a BMI over 35, if you start to add those up in the state of Ohio, it's like 60% of the population. So what I think the state is really has a difficult spot is when there's really limited supply, all of those, we want everyone to be vaccinated, right? So all of those groups are eligible. It's not that no one thinks they should be vaccinated. It's just there's only so little supply. They're trying to go with the harm reduction of those at highest risk. It started with age, those over age 80, those over 75 to 79, et cetera. And really looking at harm reduction around K through 12 teachers was really about the harm reduction of kids not being in the classroom, whether it's from a psychological, emotional, physical health, or academic health. The state made a commitment that they were going to protect both the elderly and those at high risk for severe disease through harm reduction techniques. But then by vaccinating K through 12 teachers, and as of today, getting, I think pretty much every school district in the state now open for at least hybrid, if not full on in classroom education, is really about harm reduction for K through 12 students. So I feel horrible that anyone that has a condition that's not included in the 1B or now the 1C list, but the state just really had a very difficult time trying to prioritize when, if you had 60% of the people eligible for the vaccine, you'd really be prioritizing no one. So that they are going to march down through age increments, and I think potentially have other health conditions that become eligible in the future, but that'll depend on vaccine supply.
That's exactly what I was going to ask. So first of all, thank you so much for that information, because I think there are many, and the cancer question has come up a couple of times this evening. So you do anticipate obviously a steady march down as far as the age groupings, but it could also be that certain diagnostic categories, persons with cancer, cancer survivors or others might actually get woven in as we go forward.
Yeah, it's obviously not up to us. It's up to the Ohio Department of Health. I can tell you that we're on record in writing to the state recommending additional expansion into people getting active cancer treatment. There is a large coalition of dedicated comprehensive cancer centers around the country that has also written a similar letter to the Biden administration. So we're doing our best to advocate. I think bone marrow transplant was certainly a part of our strategy, and we've gotten that as of this coming Thursday. So hopefully as there's more supply, we'll see, more groups added to that list.
So that's super, super helpful. And I think we're coming close to time here. My understanding is, so again, thank you, Dr. Thomas, for that. And it's wonderful for all of us to be able to hear kind of what's going on and the thinking behind some of it. And again, I know you don't control it. I do know that there are many probably listening in and across campus who would love for you to advocate for all the front-facing faculty and graduate students, for students themselves who may have risk factors. So again, we know you're out there pitching it, and I know that President Johnson spoke to that last time.
Yep.
So let me ask a question. I don't really have it, and I apologize, but I understand, Provost McPheron, that there are some questions being asked about timelines for registration. Can you speak a little bit to that? And again, maybe we're all having to use, so maybe you'll have to use your crystal ball on this as well. But can you speak a little bit to what you anticipate for registration timelines into the future?
Yeah, happy to, Teresa. And I mentioned this a little earlier, but it is complex because it's different than we've experienced in the past. And so let me try to clarify, and then we'll follow up certainly not only with addressing this in the question answer that we put on the website, but that Safe and Healthy Buckeyes website is a great place to watch for ongoing answers to questions as we learn more. The point that I was making earlier is the need for agility. We can plan for a fully face-to-face, high-density classroom autumn 21, something similar to autumn 19, or we can add in contingencies that actually allow us to approach our aspiration of being back on campus in a way that gives us some flexibility. So over the coming 10, 14 days, we'll actually be working with our colleagues in the colleges, departments, and schools to ask them to help us plan with the contingency approach. Right now, our best estimate is that we will have autumn 21 registration open about the same time that we have our next town hall. That's scheduled for April 12th. And so we're thinking those weeks in April prior to finals week would be the time that we would anticipate having our scheduling for fall. We would do our best, even though it would likely be a compressed timeline relative to a normal semester, to actually have our same priority cascade of students able to register. That does a lot to make sure that graduating seniors, honors students get into the courses they need, and we work our way down through those various priority groups. Our incoming freshmen would still plan to do their registration at orientation, which will be virtual, as they've done in the past. So please stay tuned as we go through the spring. As I said before, much of this really depends upon the work that we do with our modelers and public health experts, not only here at Ohio State, but across the state of Ohio and across the nation, to try to have our best estimates of what that autumn semester is going to look like. Flexibility is the key. We know we're putting a lot of pressure on our advisor community, particularly as we move into a compressed scheduling timeline. Students are going to have to think pretty quickly and smartly about what their course requirements are. And so please, students, be prepared to have your questions all outlined for your advisors on how to best fill your autumn schedule. Advisors, my thanks to you in advance for the hard work that you do every day, but realizing that we're putting a little extra burden on you with this kind of timeline. But again, it's to try to maximize our possibilities of having a terrific autumn 21.
Well, thanks. And I think that's really helpful. More crystal ball for sure, but encouraging people and to be flexible and nimble, because it's going to take that. I appreciate the transparency. So our final question, I'm going to pitch back to President Johnson, because again, we are getting more questions about it. I know you spoke about it earlier, but could you tell us a little bit more about what you're thinking, or what we're all thinking, but what you're thinking about commencement this spring?
Sure. Well, first of all, I just want to thank you, Dr. Long, for being such a great moderator, and all the panelists for taking your time to be on this program tonight, and to all the listeners. It's been a great conversation, and the more information we have, the more I think that we can do things such as think about commencement. So let me talk a little bit about both spring commencement 2021, and then also about what we might do with regard to commencement 2020. So we've appointed a task force that's looking into how we would craft a really personal and connected commencement this spring. And we're working through that right now. The first step is that we sent out a survey to both the 2021 graduates and the 2020 graduates to ask them what would be most important to them and their families with regard to commencement. Those are due back, I believe, the end of the week. Isn't that right, Dr. Shivers?
I'm afraid to speak. Yeah.
So that's super. So, we also acknowledge it with enthusiasm for the future, because we recognize we've got a lot of tailwinds. I mean, you heard today from a number of people on the call, and if I start mentioning names, I'll forget somebody, so I won't. But we do have tailwinds. We don't believe we are seeing or have evidence of in-classroom transmission of the virus. We have a third vaccine that just got FDA emergency use authorization. We've shown that non-pharmaceutical inventions at scale work. We have less than 0.5% of positivity rate, and we have a low reproductive rate for the virus. So thinking about how we can utilize those successes to do something very special for our graduates, particularly in this time, is our top priority, while keeping everyone safe. So stay tuned. I would say over the next couple of weeks, we will have more definitive plans. We know we need to, because family members need to make their plans, but we'd like to do something special. And so stay tuned on that.
Well, thank you for that. And of course, thinking about special things is really something to look forward to. So thank you for that, President Johnson. And with that, we are at time, almost exactly. So I want to thank each and every one of you for being here tonight. This was really just the beginning of a process of planning to reactivate campus that's been shared with you. And of course, that the university will continue to share updates and information as it is available. As a reminder, Ohio State will post the video for this, as well as the frequently asked questions by topic on the Safe and Healthy Buckeye website that we were just talking about. Also, there will be the link both to that and the on-campus newsletters and to the video for this as well. I would also note, as Provost McPheron did, that the university will be hosting a third, and I believe President Johnson spoke to it as well, a third COVID-19 town hall meeting. So mark your calendar. It will be on Monday, April the 12th, I believe the same time, but details will be shared in the coming weeks. So again, thank you for your questions. Thank you for your participation. Thank you to all the panelists. You've been terrific and very nimble and flexible as we went through this, but also as we're working through all of this on campus. So again, thank you for joining us. Please stay safe, stay healthy, and again, have a good rest of the evening. Thanks so much.